This is Deborah Robbins. She had an anterior cervical decompression and fusion operation 14 months ago after injuring her neck.
I had a fall down a staircase and my fifth vertebrae in the neck moved sideways, not the same as the rest of the neck. It pinched the nerves, giving me great pain down my right arm. The pain in my right side started not actually in the neck, it was right in the point of the right shoulder, and it travelled down to my right elbow and then across my forearm into the back of my hand. And when I slept, I'd wake up with pins and needles in my small finger and the ring finger. It was impossible to go to sleep without lots of analgesics. I felt like I was my life wasn't worth living because you couldn't sleep at night with the pain. You'd get up, you'd go to work. My hand wouldn't even be able to hold the steering wheel for my 20-minute drive to work. I lost a great deal of strength in the arm. I couldn't pick up heavy weights, so to go and get groceries, I couldn't get things off shelves. Vacuuming became impossible. Making the bed was extremely difficult. Oh, it was dreadful because where I'd been a person who could do anything that my body wanted to do, all of a sudden I had restrictions. And I'm a person who doesn't like restrictions, and so I sought out the doctor to try and alleviate my situation. The doctor sent me originally to the chiropractor to try and level the hips and get the spine back in line, but then he sent me on for physio, but neither of the chiropractor or the physio could remedy the situation, so we had to go further.
Scans revealed Deborah had significant degeneration in her cervical spine and a protruding disc between her fifth and sixth cervical vertebra. She was referred to a spine surgeon who recommended an operation.
The dreadful pain down my right arm and the nerve pain was just quite incredible, and I didn't want to live on painkillers for the rest of my life. It took about 7 months from the actual accident where I fell down to having the operation.
Deborah's story is a real and common one. When an intervertebral disc is damaged, the softer middle part of the disc or parts of the outer disc can extend outwards and push on spinal nerves. The opening at the side of the spine can also be reduced, pinching the nerves. This can cause pain, changes in sensation and muscle weakness. The aim of an anterior cervical decompression and fusion procedure is to reduce pain by restoring the space between cervical segments, freeing up pinched nerves and restoring stability. A horizontal incision about 5 to 10 centimetres long is made in the left side of the neck, just above the collarbone. Muscles, the esophagus and windpipe are moved aside to provide access to the injury site. The injured disc is carefully removed, relieving pressure on nerves. A cage or framework is then put into the space where the disc was. Bone from the operation site or bone graft substitute is then placed into the cage. This will eventually grow into the cage to form a solid bony bridge between segments. A thin plate may also be secured into place to provide stability. The cage and plate restore the space between the vertebrae, relieving pressure on nerves previously trapped in the holes at the side. The wound is closed to complete the procedure, which usually takes about 90 minutes. Possible complications of the operation include, but are not limited to, wound infection, leakage of cerebrospinal fluid from your spine, deep venous thrombosis or blood clots, nerve root injury leading to movement problems, pain, changes in sensation or loss of function, reaction to anaesthetic or drug therapy, excessive bleeding, hematoma or bruising, fracture of a vertebra, injury to the esophagus or food pipe making swallowing difficult, injury to the trachea or windpipe from operative instrument, paralysis or partial paralysis of the vocal cords, airway obstruction, anterior migration of the graft, and degeneration of adjacent intervertebral discs due to abnormal pressures. Some of these conditions are serious and ongoing, while others resolve over time. If you are concerned about possible complications, speak to your surgical team prior to agreeing to have the operation.
I just found life was just deteriorating, my quality of life. So when somebody tells you that they're pretty confident that they can make your life better, the quality of your life is going to be better, well, I jumped at the chance. I had no qualms whatsoever. And the doctor reassured me that his method of correcting the neck would help me, and that was enough for me. I had put my faith in him.
While success rates vary from patient to patient and depend on the circumstances of each individual case, conservatively, research suggests there is an 80% chance patients will receive good pain relief from this operation. The goal of surgery is to reduce pain by 80% or better. In patients with muscle weakness, this operation will not always result in restoration of strength, but the goal of surgery is to prevent further weakness.
I couldn't believe how well I felt straight after the operation. I was, after waking up, I was in an upright position, and the doctor came in and he said, "Oh, we're going to administer some painkillers for you." And I said, "Why? I haven't got pain." So they didn't have to administer any pain medication because with the pressure gone, I felt absolutely wonderful. My grip was better immediately, and I could pick weights up like a handbag. After the operation, I was looked after for the first couple of weeks, but I left the hospital under my own steam. I could walk. I think when you go into the operation, you have to be positive, because if you can sit and think, "Oh my goodness, why am I in this horrible collar, and it's hot and sticky and it's giving me a rash." Well, you just look past that and you look forward to the time when you'll be able to do the things again. And I was assured that eventually it would all come within the 12 months, and it did.
Deborah was able to do all self-care tasks within about 3 weeks and began gentle physiotherapy when her brace was removed at 6 weeks. She increased her activity level gradually from then on.
Getting back into normal work at about 8 weeks, and they were bringing a car for me for about 2 or 3 weeks, and then about 10 weeks till I was driving confidently. And after that, it was gradually got back into the general chores around the house, and back right into the heavy gardening by the 12 months, and really enjoying getting into everything again.
Deborah needed some treatment for a minor complication.
There's a risk of voice impairment, which I did have a small amount of, but I went to a voice clinic, and with their help I am speaking normally again. Back to a normal life, and I don't have any of the pain sensations down the right arm. I still have a bit of tightness turning to the right, but that's the only thing that I've found that wasn't there before. I've found that it's wonderful now not to have to live your life eating painkillers morning, noon and night, and to be able to get more than 3 hours sleep of a night is just wonderful. The best part of the whole experience is to get back into living, enjoying my grandchildren, being able to pick them up, and getting back into walking the dog and just enjoying my gardening again. I feel that no matter what life throws at you, you try and think positive and you get on with life. You don't sit there and look at all the bad things. You try and look, this is the wonderful new research that's been done, and this is what is possible. I feel that is the way to look at it, and hopefully everything will turn out like my surgery did. My life is back to normal, so it's wonderful.